Yeah, finally, it's my turn. Um, so today, the title of today's sharing talk is Design into Life. So it's kind of a future intelligent tailored design group. Okay, so self-introduction. I'm Hailiang Wang, assistant professor at the School of Design, PolyU. Research interests including human factors and ergonomics because I have my PhD degree in human factors engineering. HCI, health informatics design, human behaviors, and design for occupational safety and health. I am involved in several associations and research centers in and out of PolyU. Okay, the reason I call this design group is FIT. Two means. The first one is Future Intelligent Tailored FIT Design Group. See, I dream big, right? It's quite large. The other reason is from kind of general concept or definition of ergonomics. It's kind of a sense of fitting the task to the people rather than forcing the people to adapt to the task. Here, this task actually not just task itself, but also how can you complete this task kind of technology, right? So how can we fit all those elements in completing this task to the person? Of course, the answer is through design, right? Okay, so based on that kind of definition, our team, our design group aimed to applying human factors and ergonomics together with smart technology and big data techniques to design healthcare systems or devices to improve human technology interactions and further enhance people's safety and health. Those are my team members, postdoc, and PhDs. Okay, the research context of my design group is kind of very uncommon at aging society. This is a serious issue, social issue actually. So how can we, from design perspective, to help this population, especially after certain years, the physical activity limited or the mental workload or the mental emotion issues will come out. So how can we help this population? And I think the government is quite clever because they are trying to shift the burden from hospital and medical centers to community and home, right? Nowadays, we know that the public hospitals kind of overburned, right? Due to all those patients go to the emergency department first when they get sick. But can we use community and home care to, to share some burdens from this? The answer is yes, because the government is pushing this, And if we want to, enable community, how can we do? And if we want to enable old adults to quality care, what can we do? During this shifting, actually, from design perspective, we can design or come out with some integrated and innovative general technology solutions. Or those old adults at home or their community levels, they can, enjoy similar quality care if they use some general technology solutions. And here, the health informatics. Well, this is not a 100% correct definition, but just some high-level one. Health informatics, we're trying to focus on the design, development, and application of information technology systems to help to improve healthcare outcomes of old adults. We use some technology, smart sensors, to design some systems which can capture some data. And from those data, from our collaborations with data science scholars, we can get all those algorithms. And we can extract this useful information called informatics for people. And these people is actually not only old adults themselves, right? We need to think about their family members, their caregivers, and even their healthcare professionals. So all those stakeholders related to elderly care, we need to grab them in, to the design for this kind of health informatics. So in the following 10 minutes, I will briefly talk about 4 themes in our FIT design group, from health information visualization to activity, physical activity, and how we can, enable older adults to do some exercise, playing, and also the living in home. The first one, actually this information visualization. I want to use one recent research sub-study to illustrate this. We all, Hopefully no, but I guess all of us went to a hospital to take some medical imaging report, right? There are so many technologies, especially for us layperson, we don't have those technology. How can we understand those alien language, those weird images? What's wrong, with my body? I have no idea. So the team come out with, can we use AR-based visualization design to enhance the accessibility of medical imaging report for old adults? Can we transfer the 2D into 3D? Well, the team members conduct a series of design research, from formative study to discover and define the issues, to the end user study to find out some delivery, to come out with this AR-based visualization design. The results are pretty good. The old adults, the participants, they ask us, when can we use this in the real situation? If we have such techniques, we can communicate directly with the physicians. Even we don't know the terminologies, but we understand, all those 3D images. Or, if we turn on, okay, maybe physician tell us, okay, this is the issue in your lungs or your heart. They will have a very better understanding of their situations. And this is partially supported by the Color Imaging and Metaverse Research Center at PolyU. The other one is activity. Old adults, they will do some activity, based on their interest. However, just as Dr. Zhao mentioned, that we focus on mobility first. The reason is quite obvious, because old adults, may fall. There are so many reasons, can lead to falls. But why we care about this? Not only, it's very important for old adults, but also there is a huge gap between the intense workloads to from the old adults, 1.6 million in Hong Kong actually, and there is some limited resources. Let's say only 4.5 thousand physiotherapists in Hong Kong. So you can see the image, the gap there, right? So can we help those PT physiotherapists and try to improve their mobility care? The answer is obviously yes. From the design perspective, we can contribute to this direction from maybe 3 layers. The first is the sensor layers. As Dr. Zhang just shared, we can adopt a lot of sensors, depth camera, initial sensor. But how can we design those? How can we make sure that the people, they want to use these sensors, and how can we make it user friendly, right? And the other part is, let's say, the processing layer, how those data are uploaded to the server and processed. And for the application layer, I think it's quite straightforward for us, from design background, right? So the human-computer interaction, how to visualize all those data to make it user friendly. So if we can contribute to this mobility direction, we can do several things, right? First, old adults can do the body check, from their mobility part by themselves, and they can get the reference, and they can understand their body, their gait and balance, and their fall risk by themselves. The other part, we save the time, efforts from physiotherapists. They can, make best use of their time or efforts for some serious situations. And this is partially supported by future care mobility centers and the research center of textiles for future fashion. The other part is play. As we know that old adults usually play at home, maybe the neighbor, grab several in the nearby parks, but all those are kind of limited, right? If it's also due to the bad weather in Hong Kong, for example. Can we, make it unlimited? This one I think is kind of, to some level, I match with Scar's sharing, that can we make it, from physical into digital world, right? So the team think about, okay, can we mapping users, old adults, from the physical world into digital part, so that there is no limitation about the area, right? The locations. So this one is trying to create a VR-based real-time interactive physical training system. And for example, you stand in front of a camera, for example. It can capture your skeleton data. At the same time, your avatar will appear in the VR scenario, and there is a coach there. When you follow the coach to do the postures, let's say physical training the coach can correct your posture. If it's wrong, okay, stop, please correct it. So gradually, the users will become maybe the master of those kind of physical training. And we all know that there are so many, let's say, qigong in China. It's beneficial to human bodies, physically or mentally, right? But if you do it that wrong postures, well, sorry, you didn't follow the postures. The effectiveness may be totally different. This is a external grant, health and medical research fund, and the user studies show that the users they pretty like this game, and they think that okay, my wrong posture can be corrected in the real time, not just I go back to watch the videos, but it's a real time correction. And is this useful? I have no idea, because we need to do the real evaluation. So now we collaborate with the Hong Kong Christian Service. This is a very big NGO in Hong Kong, which has multiple elderly care centers. So we collaborate with this organization and trying to use our systems with their participants, their older adults. We will conduct around 6 months longitudinal study to evaluate whether or not our design solution can help older adults to provide some better outcomes. Yeah, thank you. Okay, the other one is living. Actually, I want to echo Professor Li's comments this morning. So for older adults, should we monitor them, from everywhere at home? There's multiple sensors or systems there. Is that sufficient or over-sufficient? So maybe older adults, they want to desire for independence. They have the capability to live independent while receiving support when needed. This is quite important, when needed. And they want to get support in their aging in place to have the quality of life. This is actually a paper from the literature review. We found that in their digital health at home, it's kind of health monitoring, right? The camera, the sensors, wearables, assisted living robot there, right? Robot pad. And the telemedicine and the telecare, we can get the remote care from the caregiver's professional, or digital interventions. There's some self-management, of course. There's so many, digital health there at home. So how can we, understand the user's real feeling about this? So the team mimic a living room and trying to understand more about the user's real needs about this digital health. It's kind of an ongoing project. Just finish the system review part and submit it to Kai. Hopefully, we can get some good news. Yeah, this is ongoing, trying to know more, know deeper about the users, their feelings about the digital health. Yeah, those are 4 themes, but they are not separate. Somehow they can be linked with one another. So in the future, if we conduct some elderly care projects, we may combine 2 or 3 of them. And also, actually, I just removed another one. Now my team wants to have another theme, kind of driving, elderly drivers. So we want to understand, for this specific population, can we, from design perspective, help them, to keep safe and health during the driving part. Okay, of course, for my team, just me and my 7 PhD students and 1 postdoc, I cannot get all those, but I got collaborators, just let them come. The collaborators from GBA and from local and the NGOs, and also some departments and schools at Poly, some financial support from research centers. Yeah, this is the last one. But this is the exhibition of my FIT design group. So if you have time, feel free to do that and check. And your comments are always welcome. As mentioned before, I always share this. I cannot make anything without collaboration. So my team is open for any collaborations if you are interested in elderly care part. Last but not least, I want to say that let's improve the social impact through design research, because our design meets real needs. Okay, thank you. This is the end of my sharing.